And how do you manage a situation where somebody has intermittent, episodes of dizziness?
The most common causes of vertigo include something called a BPPV, that is benign paroxysmal positional vertigo, vestibular neuronitis, labyrinthitis, Meniere's disease, migraine, benign paroxysmal positional vertigo, which is more commonly seen in an elderly population or past middle age. So they typically give history of vertigo when there is a positional change, or when there is a head position change, they have vertigo. So this history is very important, positional vertigo. So when somebody comes with a BPPV episode, we give a short course of medicines such as labyrinthine suppressants, that is our beta histine, cinnarizine. But it's very important to give it only for a short period, and after that they have to resort to other rehabilitative measures, exercises, vestibular rehabilitative exercises, lifestyle modifications, etc. The reason why I said this is, if we give these medicines for prolonged periods, there's an entity called maladaptation or non-compensation, whereby the brain doesn't compensate. The ear apparatus can be divided into three parts. One is the external ear, then the middle ear, the internal ear. So in the internal ear lies something called a labyrinth, then our ear nerve or the eighth nerve. Any inflammation of these parts also can result in vertigo. There's something called vestibular neuronitis, the nerve that controls the balance. So any inflammation can also produce similar symptoms. And the point to be noted here is, vestibular neuronitis is usually a one-time event. It never recurs. Then labyrinthitis also can, that is inflammation of the labyrinth, that is the inner ear, also can produce vertigo, nausea, vomiting. Then there's an entity called Meniere's disease. Meniere's disease, it's a chronic progressive condition. So the patient will come with history of on and off vertigo since many months, which is progressive. Then progressive hearing loss, then ear fullness, then tinnitus, that is an abnormal sensation coming from inside the ear. Again, from the history and examination, you'll be able to find out that this is Meniere's disease. Then there's something called vestibular migraine. Again, vestibular migraine and BPPV, the symptoms could be very similar, because vestibular migraine is also a very recurrent condition which can come on and off. It can come with headache, or sometimes even without headache. In between the episodes of BPP or vestibular migraine, the patient is completely all right. They don't have imbalance. If somebody has vertigo, nausea, vomiting, and imbalance is persisting, definitely we should reconsider our diagnosis and immediately subject the patient for an MRI of the brain, because stroke at the back of the brain, something called a cerebellar stroke or a posterior circulation back of the brain, stroke can present with vertigo, nausea, vomiting, and imbalance.